Welcome to World Lymphedema Day 2023. My name is Lena Löfstedt. I am member of the board of the Swedish Edema Association. We're so happy to be able to arrange this webinar with our sister organizations in Europe. We're especially delighted to have the Swedish Minister for Healthcare, Acko Ankarberg Johansson, here today. I will leave the word to you to present yourself in a few minutes. You can see we have some really interesting inputs here today. You can see it on the screen. We have a patient story from Germany, and we will have the background to World Lymphedema Day, and we'll present the manifesto, and we have the platform Compression Under Compression. And we will end the day with talking with the minister about how we should get equal care for patients with lymphedema. And we also have our sister organizations here. And after I've said a few words about the Eurolymph, we'll let them present themselves. So for many years, the Nordic Patient Association for Lymphedema have been working together, even having a biannual meeting, Nordic meeting. The last one was in Copenhagen in 2021. However, there's never been collaboration among the associations for lymphedema across Europe. So in 2019, as association joined the European Patient Advocacy Group, or the European Reference Network Världsdagen. It was the beginning of a new collaboration. As a patient association for lymphedema usually cover both primary and secondary lymphedema, we needed an additional platform to work together. Hence, a spin-off group was created. We used, among other things, Facebook to easy stay connected with each other, to share news, updates, best practice, and so forth. In 2020, we had our first official project with the creation of the manifesto. You will hear about that later. Some association took it further the next year by collecting information from our patient communities and sharing the results widely to raise awareness. We also submitted a poster about our collaboration for the 10th International Lymphedema Framework Conference, which was accepted. So today you will hear more about these projects from selected patient representations, along with our wishes and hopes for the future for those with lymphedema and their families. So now I would introduce the Swedish Minister for Healthcare, Acko Ankarberg Johansson, please.
Thank you, Lena, and hello everyone. My name is Acko Ankarberg Johansson, and I'm the Swedish Minister for Healthcare. And thank you so much for inviting me to this webinar. Sweden's dedication to the health of our citizens is evident, as we have long focused on frontline medical research and innovation, while simultaneously providing all citizens affordable access to high-quality healthcare. That said, just like many other countries, Sweden and the Swedish healthcare healthcare system has not raised enough awareness about lymphedema. It is of great importance that every part of healthcare system has updated its knowledge to enable the best possible conditions for early diagnosis and tailor-made centered treatment. The European and international healthcare system have several similarities and differences. However, the first place that you and I go to in order to seek help for a condition or when we feel sick is the primary care. Therefore, it is important that the professionals at the primary care, the GPs and nurses and so on, have updated knowledge about lymphedema in order to rule out other diseases and decide for the next step in terms of diagnosis and treatment. Some probably have to refer to specialized care with staff that has the latest knowledge and the best conditions for treating lymphedema. The care must be need-based, and tailor-made care means person-centered care and must be accessible to all. We need to do a lot of things if we shall reach that goal. The staff must have the possibility and time to continue further education. They need guidelines for the best treatment and a holistic view. You are more than your diagnosis. During the Swedish presidency in the Council of the European Union, I'm very happy that the first conference we had was a conference on cancer. I was glad to host it together with my friend Commissioner Stella Kyriakides and the Commission. Europe's Beating Cancer Plan is a good example of joint efforts in many ways in order to improve healthcare. The important thing with the cancer plan is that it is focusing on accessibility and equality. The lymphedema care also need joint efforts within the EU level, and when it gives an added value to do it on the EU level. Healthcare is not an EU responsibility, but we could do a lot together in order to boost all member states' national work. During this semester, we are working with a lot of questions as presidency. Life science, pharmaceutical shortages, new legislation on pharmaceuticals, AMR, European Health Data Space, and a lot more. And I must be clear, we don't have lymphedema as a special working issue this semester, but it is visible in the Europe's Beating Cancer Plan and in the work with a sustainable medical device regulation. Today's event, the World Lymphedema Day, challenges us politicians to provide a better awareness and a better care for patients with lymphedema. I'm very glad that we are all gathered here today virtually, and I look forward to hear more about the EuroLymph collaboration and your efforts on raising awareness to improve the care for people living with primary and secondary lymphedema and other lymphedema diseases. I look forward to listen to you all and learn more about problems and challenges, but also about hope for patients with lymphedema and their families. Thank you.
Thank you very much, Acko. It's very like the things we want. You will hear that later today. So now we will hear from the patient association. So please start Bulgaria first. Please, Petya.
Hi, my name is Petya Stoicheva. I am representative Bulgarian Lymphedema Association. This is Bulgarska Associacija Lymphedem.
Hello, my name is Pernille Henriksen. I am from Denmark and I represent the Danish Patient Association, Lympho.
Next. Germany or France?
Hello, my name is Alain Pradel. I represent France and I'm acting as representative of AVML, Association to Live Better Lymphedema. I am also represent on the behalf of two other French associations, which name is Lymphoedema Family and Lymphoedema Rhône-Alpes. Thank you.
My name is Karina Meinkoff from Germany, and I speak on behalf of our largest umbrella organization in Germany, Lymphselbsthilfe e.V., and which looks after all kind of lymphedema in Germany. And I speak for KIF 11 Kids, which is specialized for kids.
Hello, everyone. I am Elena Matta. I represent Italy, and in particular, I represent a patient association called Lymphedema in Italy. So thank you for letting me be here.
Hello, I'm Manuela Lourenço Marques. I'm from Portugal, and I represent the patient associations, the patients in Portugal for lymphedema, and also vascular rare disease and lymphedema. Thank you for your time.
I'm Sandra Ardila from Spain, and I represent associations in Spain.
In Sweden, I'm Lena Löfstedt. I've already represented myself from the.
Hello, my name is Elina Halstra. I'm from the Netherlands and I represent NLNet.
Hello, I'm Karen Friet. I represent the UK and I'm here today representing the Lymphedema Support Network and Lymphoedema. Thank you for your time and inviting us to join you.
We're just missing Norway also.
Yes.
Elin Madsen is from Norway and she represents the Norwegian Lymphedema Association.
Okay, thank you. I hope you can come in, Elin. Thank you very much. I will now introduce Karina Manka, who is a mother of a child with primary lymphedema. Please, Karina.
Yeah, thank you. Thank you very much for listening to my story. My name is Karina, and I'm the proud mom of a child with primary lymphedema. This is Paul. He's 6 years old today, and day one in his life marked the beginning of his story as a child with a rare condition and our journey as caring parents. We directly saw the swollen feet when he was born, and we were told that it would go away on its own. Oh, what a mistake. Today we know that not only the feet, but his whole body is affected, and a lifelong daily treatment will be necessary. Many visits to the doctor and many misdiagnoses later, we learned that a rare genetic defect called KIF 11 is the cause of it. We started the treatment right away with manual lymphatic drainage for his whole body. We tried different types of bandages and tape methods. And when he then finally learned to walk, he got his first fitted compression socks. But as you can imagine, children's feet grow very quickly, and fitting new stockings is part of our new routine in life. Thanks to the daily management of the edema, the feet have become so good that Paul can wear normal shoes, something I didn't dare hope for a long time. The management of the edema will be necessary for him for the rest of his life, according to the current state of science. However, the custom fit compression garments also preserve a lot of quality of life. My impression is that the lymphatic system still receives little attention in professional circles today, even though it has such a great impact on our body. Lymphedema on the limbs can be seen and felt, as you have seen on the pictures already. However, there are also many diseases and risks like skin infection, cellulitis, etc., associated with the lymphedema that are not directly visible to the naked eye. Did you know, for example, that the lymphatic system is also responsible for fat utilization? So Paul's symptoms then continued with diarrhea, vomiting, and sleeping problems. But none of the clinicians considered the lymphatic system as a cause. And the years of vomiting led to extreme underweight. And as a result, Paul is tube fat. We parents become experts on our children's illness. And besides the feeling of helplessness, we mainly felt alone for the first years. Even if we assume that we already have stable and well-developed healthcare systems in Europe, the path to diagnosis of primary lymphedema or lymphatic diseases in general still takes far too long, and parents are left to their own devices. So I would like to tell you about a case of a Swedish mother who contacted me via social media. Her son Johannes is 20 years old and also has been diagnosed with the genetic defect KIF11. And despite this, the mother cannot find a local clinician who could diagnose the primary lymphedema and initiate further treatment. But not only in Sweden, many parents all over Europe invest a lot of time in finding the right experts, finding a good medical supply store that can measure the children's feet correctly. And these parents discuss with health insurance companies about the cost coverage of the expensive stockings. And these parents research on the internet and network as best as they can to gain knowledge. And these parents travel also long distances to expert centers to ensure that their child is well cared for. But these parents, for whom I stand here today, also need an interdisciplinary team of experts at their side who try to understand the complex interrelationships and create easy to understand access to the already available knowledge. And the psychological aspects for us as parents, but also for the kids, is also important to consider. The primary lymphedema is statistically a rare disease. We hope you can share our manifesto in Europe, and we parents hope you can be a voice for more research, which brings better quality of life, or even better, a chance of cure for our children in the future. Thank you for listening to my story.
Thank you, Karina, for this powerful story. Please let me now introduce William Rapicci, CU for Lymphatic Education and Research Network from the United States. Via pre-recording, he will explain the origin of World Lymphedema Day.
Hello, my name is William Rapicci, and I am the president and CEO of the Lymphatic Education and Research Network based in New York City. I greet you today on our organization's 25th anniversary of fighting lymphatic diseases through research, education, and advocacy. I was so honored that Margareta Haig of the Swedish Association of Chronic Edema asked me to address the Swedish Minister of Health, Minister Johansson, and all of the ministers of health in Europe as we celebrate World Lymphedema Day. Sweden has long been a leader in healthcare, and this is why many years ago I traveled to do my graduate studies at the University of Lund so I could bring the wisdom of your country for the developmentally disabled to the United States of America. Today, I hope to collaborate once again, this time in the name of the 250 million people worldwide that the World Health Organization has identified live with the incurable, debilitating, and progressive disease called lymphedema. World Lymphedema Day, March 6th, was established in 2016. I was honored to actually write the resolution creating the day, which Senator Charles Schumer of New York brought to the floor of the US Senate, where it passed unanimously. Quickly, World Lymphedema Day spread across the globe, and it gave a voice to the millions who clamored for change. Some of those strongest voices are from Europe, where over 20 patient organizations called for a manifesto that calls for equal treatment in healthcare and research funding to find treatments and cures, and a commitment to better quality of life for those living with lymphedema. In Europe and the United States, the majority of those with lymphedema have it as a result of either cancer treatment or surgery. For example, up to 30% of women who survive breast cancer will develop this incurable swelling that deforms the body, leads to ongoing infections, and demoralizes the soul. In India and other tropical countries, a high percentage of lymphedema is due to the effects of lymphatic filariasis. This is a global issue. And yet there is not a single drug that controls this disease, and doctors are often uneducated about how to treat it. Things are beginning to change. We now have 50 learned centers of excellence in the diagnosis and treatment of lymphatic disorders around the world. 10 of those centers are in Europe. This year, our National Institutes of Health in the United States has established a national commission to study the need for lymphatic research. Our Centers for Disease Control has awarded our organization a $1.2 million grant to educate people about cancer-related lymphedema. And this campaign is led by our spokesperson, Academy Award winner, Kathy Bates, who also lives with lymphedema herself. And for the first time this year, our Department of Defense has opened their $370 million medical research budget to lymphedema and lymphatic disease researchers internationally. I'm now in contact with researchers all over Europe who are applying for funding. We look forward to joining forces with the European Commission in making strides in research and healthcare for those living with lymphedema. Thank you for this opportunity to address you today as the world raises its voice on World Lymphedema Day.
We will now hear from Pernille Henriksson, who will tell us about the manifest and how it came about. Please, Pernille.
Across Europe, patients with lymphedema are struggling to get a timely diagnosis and adequate treatment for this chronic disease. One major problem is the low awareness among the public and the healthcare professionals. Patient associations across Europe wanted to raise the attention with politicians, policymakers, healthcare professionals, researchers, and the general public towards the needs of those who live with or who are at risk of developing lymphedema. Hence, patient representatives of different patient associations in Europe decided in 2020 to unite to initiate the change, to raise awareness of lymphedema and strive to improve the current situation. We used the World Lymphedema Day, March 6th, as a platform to reach the public, policymakers, clinicians, as well as patients with a co-signed manifest outlining our challenges and needs. We ask for increased funding for medical research, educational programs for healthcare professionals, and improved access to specialized care to those with lymphedema. Since then, we continue to network, collaborate, and work together. And this year, 24 patient associations have joined our initiative across 13 European countries, with the manifest translated into 12 languages and shared across the world. Despite national borders, cultural and linguistic differences, we are united for the benefit of the patients. The road is still long, but each effort is a step forward and help us to raise awareness, inform, and improve the quality of life for those with lymphedema and their families. Today, we kindly ask you to bring our manifest to your peers in the European Council so that they too can learn about our condition, our struggles, needs, and wishes for a better future. Thank you.
Thank you very much, Pernilla. We will now hear Elaine Hoekstra, who will introduce us to the new website that puts compression under pressure. Please, Elaine.
Thank you, Lena. First of all, I would like to thank you all for this great opportunity. And as Pernille already mentioned, we united and created this great manifest, of which we are all very proud of. And in 2021, we gathered once again for World Lymphedema Day. We were all gathered in a big Zoom session, somewhat comparable to this one, with almost 20 European patient organizations discussing what would be the best theme for us to focus on for patients on behalf of World Lymphedema Day. And the challenges vary enormously per country, but the one thing we all agree on is the importance of medical compression garments. There is no cure yet for lymphedema, and medical compression garments are essential for us patients to maintain and self-manage our lymphedema. So that's why we agreed upon this theme, and we decided to create a social media campaign to gather data of the challenges European patients have to face in obtaining their medical compression garments. We created one single statement: I struggle to obtain the necessary garments to manage my lymphedema or that of the person I care for. This statement was scaled from 1 to 5. 1, I strongly disagree, and 5, I strongly agree. And people could also write down the challenges they had experienced. This statement was launched via a social media campaign in 24 countries into 13 different languages. Within 1 week, we received over 1,100 responses, and it shows that 59% of the people answered do struggle, and that's a large number. But what are the main challenges they are facing? Those are financial challenges, the prescription process, and the measurement and fitting of the garments. Financial challenges and the prescription processes vary too much per country, but measurement and fitting, those are applicable to every patient who needs to wear medical compression. So once again, as a group, we found a common denominator to focus on. So we decided to unite again in a Compression in Europe working group to put compression under pressure. And we decided that there was a need for a knowledge platform for patients, a platform on which patients in Europe can find easy accessible, user-friendly information regarding compression garments, like measurement tips, the fitting, compression for children, how to maintain your compression garments, a platform to empower the patients, a website made by patients for patients. And I'm really proud of our group and our website. I mean, we are here as a team and we have never met. We speak different languages. We are all volunteers and all patients, but we do manage to work together in this very positive and constructive manner. So I'm really proud. And please share our platform, www.compressionineurope.org, with your colleagues and within your community. Help us to create awareness for lymphedema and help us to put compression under pressure. And as a closure, I want to thank you very much for this opportunity and happy World Lymphedema Day.
Thank you, Elaine. We will hear more from you now. You will tell us about how we share our wishes for a recognition of World Lymphedema Day in Europe. So, welcome again.
I think it was me, Lena, that I wanted to say.
Pardon?
For the recognition of World Lymphedema Day, we want to say it is astounding how so many people suffer with lymphedema, yet so few people have heard of it. So today we hope that we have made an impact to inspire you to help us reach wider, to have more effect on our cause. To bring awareness to this disease, we ask you for the support of the recognition of the World Lymphedema Day in Europe.
So thank you very much, Pernille. It was your turn, my fault. Now we had a lot of interesting inputs, and now we'll have a discussion with the minister. So, Acko, will you be there?
Yes, I am. And thank you so much for all contributions. And I will start with thank you, Karina, from Germany, about your important and powerful story of how it is living as a parent to a child with a rare disease and primary lymphedema. These reports are indeed essential for us politicians to hear. We need to improve the healthcare. It's clear when you have spoken. And I would also like to say thanks to Mr. Repici as the founder of World Lymphedema Day for your work of raising awareness of these diseases. And I am also glad to hear about the fantastic work that is happening around Europe and worldwide. At the same time, it is struggling to hear about the massive challenges there is with the compression care and the garment fittings. You are doing a great and very important work on raising awareness and challenges us politicians to do more. I think there's a big need to do more and improve the healthcare system to be aware of lymphedema.
But how do you think we can change so that the lack of competence and knowledge in the European healthcare system will be reduced and less unequal? Do you have any ideas, any plans?
I don't have a plan today, but I hope that I will have a plan further on, because we need a joint effort. And I think EU can play an important role in that work, because the patient is the heart of the healthcare system. And listening to you, it is obvious that it is not working today for the patients with lymphedema, and we need to do more. And I hope to do more, both in Sweden and during the presidency, both in questions due to the medical device regulation, of course, the Europe Beating Cancer Plan, but also on different initiatives that could be useful in the work for a better care for lymphedema.
Yes. I think it's a big problem is that the doctors they don't learn about the lymphatic system when they go to university and have their exams. I listened to some doctor who said the other day that they only have at maximum of 15 minutes about the lymphatic system. And that's really a problem. I know you can't do anything to that, but if we should get better and equal care, and you come to the primary care, if the doctors don't know about lymphedema, it's really difficult to get a diagnosis. And I think it's easier for people with secondary lymphedema, because they know that after cancer surgery, you may have lymphedema. But for the people with primary lymphedema, it's worse, exactly as Karina told us about.
Yeah,
so
I agree with you that the basic education for the staff need to be better, of course, but also to everyone working in the healthcare system, they need to get continuously further education, because you need to get knowledge about new innovations and the new research. So it's important that every country have a plan for further education for the healthcare staff. And of course, it's important that we see that lymphedema is different diseases. It's both primary and secondary lymphedema, but also other diseases. So it's a big challenge to get more knowledge to the staff working in healthcare. But I will especially stress the importance of continuously further education, because I think that is important for the primary care staff. They need it as a ground for everyday's work with the patients.
But it's also as someone said here earlier, that there's in the societies there's very little knowledge about lymphedema, and if you talk to your friends about it, they hardly know about the lymphatic system. So we have to increase the knowledge in the society too. A lot of people, they don't want to go to the beach and go in a swimsuit, because other people look at them and they see they have deformed legs or arms or so. So we need sort of a campaign over the countries to so that everyone will know about it. What do you think?
Yes, I agree on that, because we need a better awareness in the public about this disease or diseases. And we also need better knowledge about the disease in the healthcare system. So I'm very glad to hear that you address both the public and the healthcare. And I think you as networks and organizations play an important role, because you gather people, you could put out, you tell us about where are the needs and what shall we do, and you bring out awareness to people through your work. So I'm very glad for the work that the Swedish Svenska Idéförbundet is doing. And I'm very glad to hear today about the other organizations in Europe working together for this important task.
I would ask Elaine or Pernilla or Karina if you have a question that we could talk about.
Or maybe good examples for me to bring in the European work, or maybe to Sweden. So please bring it on.
Yes.
Well, of course, you were talking about also the beating cancer, the European plan for beating cancer. So you said there was already something about lymphedema in there, something about perhaps prevention or prevention of lymphedema or early detection of lymphedema related to cancer treatment?
There are a lot of things in the Europe Beating Cancer Plan, but the point I was thinking about was quality of life, because I think that is an important issue. We need to bring quality of life as a part of the healthcare work, because if we only talk about treatment, then we will miss the holistic view. And we need to also talk about quality of life together with treatments and the right diagnosis in right time and so on. And I think rehabilitation, lifelong rehabilitation, is one of the important issues that the European Cancer Beating Plan is bringing on. So quality of life, I think, is the most important thing that I want to address from the European plan.
Elaine, do you have any question?
actually, I'm already pretty happy with this great opportunity. And yeah, so for now, no real question. Please share our platform and support our initiative.
Yeah, I really like your initiative about compression under pressure. That's a good one.
Yeah.
And I will bring that with me. Thank you.
Yeah, we had some David Bowie fans in the group, so
good.
Yeah.
So, Karina, you want to say something? We already heard you tell your story, but after you have listened to the minister now, any reflections?
Maybe now, if you're asking me for a personal question, maybe what would you recommend parents with smaller kids to do when they realize something seems to be wrong? What would you do? What would you recommend them to do? I know that's a hard question.
I'm not a medical staff, so I couldn't give advice in that kind of way, but I think you are doing just the right thing, because when you see that your child is not going well, you need to go to the primary care. When you get there, you should get the best treatment, and you should get the best. They must have the best awareness about what could this be, and they should not leave you until they have found the right diagnosis. And a lot of people are telling me about it's kind of a black hole because no one is listening to me. And I go to the first doctor and the second doctor and the third one, and no one is really, maybe they are listening, but they are not work that hard to find the right diagnosis. And this is important with the primary lymphedema, that we really find out what is wrong and give the right treatment, maybe in the specialized care. So your story is really worth listening on for every working in the healthcare sector.
Yeah, so many things to do. I'm so sorry. Maybe if I don't know if I'm allowed to speak, but I have to say, thank you very much, because this is very important. And as you can imagine, it's a very, well, you have so many things that we need answers for. So we really need your help and your bridge to the European Union, because we have to do something in Europe. We have to change this in all countries, even each one has a different way of answers, but we need the answer for sure. Thank you very much for your time. I'm sorry.
So, when I listen to both my sister organizations here and to you, Acko, I think that I hear we have the same goal and we talk about the same things, what we ought to do. So now one just wonders, do you think we will live to see it happen, that we get better care in the future?
Yes, I hope so, because we couldn't only talk about the problems and challenges today. We need to give hope to patients and their loved ones. I think it's important that we could point out things that we will do the coming years to make lymphedema care better and better for all. It is important.
And we've already different persons here told you about different things which we hope shall happen the coming years. But we also have a special wish list for patients. And it's worth 5 points, and I'll take that now. And it's 1, recognition of lymphedema as a chronic disease. 2, increased awareness of lymphedema in the society. And reduced delay for diagnosis. Continuity of care. And specialized national centers with multidisciplinary teams accessible for both primary and secondary lymphedema. This is our wish list that we hope you will take with you.
I will. Thank you so much for your wish list.
Thank you.
It's a good wish list. Thank you.
So I think we've had a nice talk. We have really good inputs to the discussion here today, and I will thank you very much for being here with us, both our sister organizations and especially you, Acko. It's not every day you get the opportunity to talk to the Minister for Healthcare. So thank you very much, everybody. And we look forward for all the things we talked about, that it will come true. Thank you for today.